there was a complication in the ICU afterward that left him with a permanent brain injury. It's my belief that had they had the kind of resource that US News now provides to families, they might have identified that that hospital didn't have adequate experience treating that condition, didn't have the whole team and depth in their bench to support that child after the surgery and make sure that they had the right outcome. And they might have chosen a different hospital if they had a resource to point them in the right direction. I think about that when we are gathering the data that we gather, when we're analyzing it, when we're putting together the rankings and making sure that families are, know about the data that's available at usnews.com, because I really wish that my aunt and uncle had access to a resource like that 50 years ago when they were trying so hard to get the right care for their child and the information just wasn't available to them.
Hello, my friends. I'm so happy to be with you today. It is Tuesday, October 7th, 2025, and what that means is that the U.S. News Report has officially launched their list of the best children's hospitals in 2025. We had the amazing opportunity to speak to the journalist who is reporting on this, and his name is Ben Harder. I can't wait to introduce you to Ben in just a few moments and talk to you about how he's a dad, how he's a reporter, and why this topic is so important to him. But I would be remiss if I didn't tell you the general excitement I have to be a part of this conversation. The fact that the U.S. News Report wants families who listen to Child Life on Call to have access to this information and not just know what the rankings are, but know how to actually use the information to improve the care that their kids get is what this podcast is all about. I love the amount of information and resources that we get to share on this podcast. While we primarily feature families who are sharing their stories and experiences, it's hearing from experts like this on the real state of healthcare and where families are receiving care for their kids that matters. I'm not going to spend the entire podcast going through the top 86 hospitals of the 200 that were investigated for this, but what I will tell you is that these are all freestanding children's hospitals or children's within a larger adult hospital. These are all hospitals that have been featured not only for overall ranking and their best honor roll is what they call it, but they also want families to be able to search based on specific populations and diagnoses in areas of care. For example, the premier cancer hospital, the premier place to go get neonatal care, the best place to get nephrology care. They've also put together lists based on your region so that families can make decisions about the best places to receive care based on where they live in the country. As Ben and I talk about in this interview, these rankings are just a piece of the puzzle. And when you're deciding the best place to go get care for your child, it's a whole inclusive discussion. Of course, you have to look at your insurance. You have to look at where your family is located. You have to look at so many different factors that make a big impact on where you choose to receive care. But I do ask Ben a lot about Child Life Services. I ask a lot about the impact of family expertise and experience and how that impacts the rankings. And I can't wait to share our conversation with you. It would take a lot of time for me to read you the entire list of hospitals here, but I do just want to mention the top 10 and what they call their honor roll. So this is across the country. This is not by subspecialty or by region, but you can also go and filter the results that way. But in alphabetical order, they have Boston Children's Hospital, the Children's Hospital of Colorado in Aurora, Colorado, the Children's Hospital of Los Angeles, the Children's Hospital of Philadelphia, Children's National Hospital, Cincinnati Children's, Nationwide Children's Hospital, Rady Children's Hospital, Seattle Children's Hospital, and Texas Children's Hospital in Houston. A big congratulations to these top 10, but I really urge you to go to the U.S. News Report and look at the best children's hospitals in your region and for the specialty that you're interested in. Okay, let's get to our conversation. I have a special thank you just for you, our podcast listener. Right now, you can get free access to our most popular course and masterclass, How to Prepare, Support, and Respond to Your Child During Shots, Blood Draws, and Vaccines. You can also get access to how to use comfort positioning in pediatrics. These courses usually sell together for over $250, but we're giving it away to you for free. All you have to do is leave a written review for this podcast, Child Life on Call, on Apple Podcasts or Spotify. Give us a quick screenshot of your submitted review to podcast@childlifeoncall.com. Once we get your email, we'll send you the course completely for free. There are no strings attached, just our way of saying thank you for supporting the show and helping more parents find our podcast. Send us a screenshot of your review to podcast@childlifeoncall.com. That's PODCAST at childlifeoncall.com. Can't wait to get you free access to this course. Friends, I am so excited to introduce you to Ben Harder. He oversees the methodology and data analysis for the U.S. News and World Report's portfolio of data-driven patient decision support tools, including the best hospitals and best children's hospital rankings, the best hospitals for maternity care, and the best nursing homes ratings and searchable doctor directory. He is a wealth of information. He's a father. He has taken his child to the hospital before. He has family experience in this area, and I love when we can blend his professional expertise with his personal experience to talk about what these rankings mean and what families need to take away. Ben, please tell us a little bit about you and why this topic is so important to you.
Yeah, I mean, a couple of different things led me here to being at the helm of the Best Children's Hospitals Project at US News. One is that I very much wanted to tell stories that are meaningful to people. And so I started out after college as a journalist, interviewing experts, interviewing family members. I was specifically interested in medicine and healthcare. So I quickly fell into that onto that beat, and I became really interested in the experience that patients have when they are critically ill or when they have complex medical conditions, which often involves one or more trips through the hospital. And so I started reporting on hospitals and the medical care and the innovation that they have, but also the dangers and the challenges of being a patient or being a family member of a patient. And U.S. News had been ranking hospitals. At that time, I ended up getting an editing job at U.S. News, but it was already publishing hospital rankings, and it wanted to develop rankings of children's hospitals. And so I actually joined just as we were getting ready to publish our first edition of the Best Children's Hospitals rankings. That was in 2007. And we have expanded it, we have refined it, and sort of deepened the rigor of it. We've added a lot of information for families, and so it's been really gratifying to be part of that process. My background again is a journalist, and I've come at this through the lens of what do readers, listeners, viewers need to know to help them make the best decisions in their life, and that's really U.S. News's mission as a whole, but specifically around the Best Children's Hospitals rankings, we're designing something that families can use to make data-driven decisions.
Yeah, would you mind kind of walking us through what that methodology looks like and explain it to the parent who doesn't understand all of the way you look at it, but maybe just what are some of the key aspects that you look at when you're deciding these rankings, and how do you come up with the results?
Yeah, so we collect over 1,000 data points for each hospital that we analyze to produce the rankings, and we publish an overall ranking for hospitals in each state and each region. But the real meat of the work that we do is around specialty specific rankings, and the goal being to identify, because each family is different, each patient is different. What the kind of care that a child with leukemia needs may be quite different than and the hospital may in fact be different than a child who's born with a congenital heart defect or who is critically ill at birth and needs NICU care. So we want to evaluate each of these different service lines or specialty areas separately so that families can identify, given the needs of their child, which are some of the hospitals that are strongest in providing that kind of care. So we collect over 1,000 data points per hospital. Those are grouped according to which clinical, which specialties they're relevant to. And they broadly fall into kind of three categories that I'll just mention. I can obviously go into detail about some of the specific measures if you're interested as well, but broadly they fall into three categories. One is sort of the resources, the structural characteristics of the healthcare provider, the system, the program that's providing the care. Do they have enough nurses? Do they have the types of expertise that patients need to succeed and have good experience and good outcomes? Do they have access to advanced technologies and treatments that some of their patients may need? So those sorts of resources and structural ability to deliver good care for the child, again, the pediatric cancer patient or what have you. The second area is processes of care. Does this hospital follow best practices? Are their providers good and consistent about washing their hands to prevent infections? Do they make sure that medicines are administered when appropriate to the right patients and not given at the wrong dose and that sort of thing? So those kinds of processes of care, following sort of the guidance that experts have developed and honed over many studies, many years of practice and experience. That's kind of a second group of quality measures that we collect. And then the third one, which is really most important to patients, to families, and to doctors and other providers, is outcomes, right? And so, did this child survive the bone marrow transplant? Not just the surgery itself, but the follow-up care and the complications that so often emerge. Did this patient have a long length of stay after their heart surgery and so on? Were they able to get home, back to the comfort of their homes, start their recovery, maybe go back to school if they're of school age? So those sorts of outcomes are, of course, really important and very meaningful. There's sometimes a little bit outside the control of even the best medical team, and so for that reason, that's not the only thing that matters when we're assessing quality. We do care about the processes that I talked about and the structural characteristics, the resources that the hospital could bring to bear as well.
Wonderful. So it's kind of these three pillars that you're able to look at over 1,000 different data points. And then I know there's some almost, I don't know if it's narrative, but maybe data that comes from work groups that look to give expert opinion on this as well. Is that correct?
Yes, we enlisted help of almost 200 experts who make up about a dozen work groups that we have. And they don't provide direct input on which hospitals are best at one specialty or another, but what they do provide, and what is really critical, and they all serve as volunteers. I mean, these are busy clinicians and researchers who are doing this out of the goodness of their heart and because they care about making sure that the data that we collect and the way that we analyze it and present it to families is meaningful and reflects what families need to know about the quality of care. So I'm enormously grateful for their contributions, their intellectual contributions, and their contribution of time. So these doctors, mostly doctors, there are some other types of of experts that we bring into these working groups, but these experts bring their expertise. They hail from all over the country, many different healthcare systems in the country, and what they advise us on is what data points to collect, and very specifically how to define those data points, because we survey hospitals and we tell them, we need to know how many patients of the following diagnoses did you treat, and how many of them had a readmission within 30 days of a surgery, or survived the initial hospitalization with at least this level of function, or whatever the outcome measure that we're looking at. And so they help us define exactly which patients should be included in the measure, what the outcomes of interest are, and there are technical sort of like codes that healthcare systems use to record these things, and so we need their expertise to help us think through exactly how do we define this, how do we capture the right data, how do we communicate that to hospitals so that they're giving us the slice of data that we need to analyze them in a fair and meaningful way for families.
Got it. That makes a lot of sense. And especially when you're coming up with those diagnosis specific rankings or specific populations that you're working with, their input is incredibly important. Do you see a future where families, parents, or even former patients might also be a part of shaping how hospitals are evaluated? And do you think that family experience or perspectives could eventually make their way a little bit more into the rankings?
Yeah. So we do get input from family members. Sometimes it's unsolicited. I mean, we have an open inbox, and people will send us letters describing their experience or recommendations. And we try to follow those recommendations wherever feasible. I mean, sometimes it's this measure is really important to us, and we'd like you to highlight it more. Other times it's we wish we had information about X or Y or Z, and that sometimes that information is gettable, and sometimes it's not so gettable, or we're not confident that we can really trust the data that we're able to get, and so we may not be able to fulfill every idea. But nevertheless it's a vital stream of information for us. We have at times had involved sort of family members in conversation, like formal conversations where they're interacting with clinicians and advising us simultaneously. I think we've actually found it often most meaningful to hear their stories and their ideas separately, because it's often not sort of cloaked in the same medical jargon and so on, but it's an unvarnished take on what matters to them as a parent, or as a caregiver, which is incredibly helpful and very complementary. I mean, there's one group, for example, that just comes to mind of parents who have had children with congenital heart disease, and so many of them, some of them have children who are now young adults and have done really well, and others lost their child, far too young, but are still so committed to helping other families that they participate in this association of family members who are advocating for better care for congenital heart disease, and are also advocating for the interests of those young patients to the clinical community. And so they have, over the years, brought together groups of clinicians from different hospitals to talk about what matters to families and to give them feedback on what they need to be focused on, even data points that they would like to see hospitals put out, so that U.S. News can use them. And so I've attended a number of those meetings, in fact, at their invitation, sometimes spoken there, sometimes just been there to listen, but always learning an enormous amount. And so I think that's just an example of the power of families to guide both medical care itself and how U.S. News interprets that medical care for the benefit of all families.
Yeah, absolutely. From that family perspective, what is really your goal at US News for how families should use and look at these rankings? For example, if they notice that the hospital that they've been attending doesn't fall within that top 10 honor roll or perhaps within that specific population, what are some things that they can start asking to that hospital that they're going to, or maybe they should be thinking about when they're looking at these rankings?
Yeah, that's a fantastic question. So, when a family faces an unknown situation with their child's health, my experience is that the parents tend to seek information everywhere. There is no patient or family member I know who is more motivated than the mom or dad with a sick child. And I have been consistently amazed at how much they have educated themselves about the condition affecting their child and how many different resources they've sought out to make sure that they know everything they need to know to take care of their child. That really has stood out to me, because we also evaluate hospitals and all kinds of adult concerns, and those patients are very engaged. It's themselves on the line in many cases, but none of them can hold a candle as a group to how parents approach taking care of their children. And so I think we know that the rankings that we publish are and should be only part of the information that they use to help guide their child through that very challenging journey. Obviously, they need to consult their child's doctor and the care team that they've already established. Sometimes it's just a primary care doctor or a specialist who's made a diagnosis and said, this is unfortunately something you're going to need to get specialized care for. I might be able to help support you, but you may need to go to a hospital. Perhaps it's right here in our town, or maybe it's a few towns away, or maybe it's across state lines, but you need specialized care here. And so we want to be complementary to that and provide information that families can use, but obviously in conjunction with everything else. I mean, they have to think about travel time. They have to think about which hospitals are covered by their insurance plan. They have to think about the time off from work to get to and from appointments, or the time away from school if it's going to require the whole family, relocating, which sometimes it does. But to try to help them on that journey, I mentioned that we rank hospitals in different specialties so that they can identify the specialty ranking that's most relevant to their child's diagnosis. But we also rank hospitals regionally to identify those that are close to home, that may be convenient, that they may have providers within their community who have, are affiliated with those healthcare organizations and can therefore kind of coordinate care, which is really important for any kind of chronic disease, as you know. And so I would recommend that families start on the usnews.com website. Everything that we publish about hospitals is freely available, so they don't have to subscribe or anything. And look up the hospitals in their region, their state, or the states surrounding them, and also look at our rankings by specialty. If their child has an orthopedic concern, we have an orthopedics ranking. If they have issue with their kidney, we have a nephrology ranking, and so on. Between those two pieces of what we've published, they can identify hospitals that they think might be suitable, and then they can drill down into the rich information that we've published on those hospitals' profiles, which is organized by specialty and broken up into different categories that they may be interested in, including things like outcomes that we talked about before.
Thank you for clarifying that. And I love that, this is just a part of the decision making. And there are so many different factors that have to go in for families when they're choosing the care for their child. And that's one of the soapboxes I always have, is that you actually can pick your child's care team, especially when it comes to specialized care. And you can try to interview some physicians, see which ones feel best to you, what care team takes the best care of your child, which ones are listening to your mom or dad gut. And those are also part of the decisions to make when it comes to really finding the best care team for your child. I want to transition a little bit over into, I think, what would be that first pillar that you described, and that's the resources that are available to families. And, it's great to see that Child Life Services are a part of this overall scorecard with chaplains and access to support groups and family advisory boards and interpreter services. And what do you see about the data on those types of services? And do they move the needle for hospitals in their hospital rankings? Do they get closer to the top of the list if they have those services?
Yeah, that's a great question. So each of the measures that we use can move the needle for a particular hospital, right? And so, even if most hospitals have a service and one doesn't have a service, that may make it more challenging for them to achieve that ranking in a specialty or in multiple specialties. And I think that has a couple of effects. One is, first of all, it makes sure that the first hospitals that parents may consider if they're consulting our rankings are more likely to have a broad suite of the services that you just mentioned and others. The second thing is that for hospital leaders, seeing that they are missing something that other hospitals have and that is associated with a higher ranking because it's associated with better care for children can be a very motivating insight. And so we have a lot of healthcare executives who pore over our data. We actually do have a portal where they can view that information in great detail, and they can compare themselves to peer groups that they create of hospitals that they see themselves as sort of peers of, or aspirationally want to be similar to. And we have absolutely heard from leaders saying, we don't have this service, and we've identified that as a gap because most of our peer hospitals do have that service, and so we're going to devote resources to getting that. It's interesting because that also has a certain effect in terms of the clinicians themselves. Obviously, they're thinking about which services are important, and that's part of what our work group does, is advise us on what are the areas of expertise that a care team needs to have to ensure, say, that a child born with congenital heart disease has a good outcome. And I'm just naming that as one example, but we get recommendations from that work group, and we, with their input, decide which job functions, which areas of expertise need to be are included in our survey and our data collection effort, and therefore something that hospitals really do focus on. And as a result, it actually gives some power back to frontline clinicians and care providers, because if they feel something is important and they put it on our survey, and maybe it's not a revenue driver for hospitals, and so many hospitals haven't invested in having that, having enough chaplains or having enough child life specialists,
Right.
it can give the executive suite some pause if they're not at the same level on some of these metrics as their peer group. And so sometimes we've had our expert working group say, you should add this measure, even though most hospitals have it. There are some laggards, and they need to know that they're laggards, and that's an important thing. Like, they need to close that gap. And so by making this a measure that matters, you'll raise
Yeah.
the level of care at hospitals that can do this but haven't made that decision yet.
Yeah. Thank you so much for bringing that, because as a child life specialist, I'm so glad that we're a part of this scorecard and to see our profession there listed as part of the support services that are necessary. But from my experience, child life specialists can often be overlooked services, regardless of the data that shows that we reduce sedation and save costs, improve patient outcomes, enhance family experience, and improve staff workflow. Why do you think it has been a bit of an uphill battle to embrace the importance of these specialties and services, and why aren't they more well known?
That is a great question, and I have some informed guesses about it. They're not necessarily linked to the data that we're using in our
Yeah,
rankings, but I've absorbed a fair amount over the years talking to families
sure.
and talking to clinicians and hospital leaders. You know, Even though most healthcare is not for profit, making sure that the lights stay on is critically important to all organizations. And I think especially when times are tight, and I think times are getting tight for a lot of hospitals, particularly children's hospitals, as some Medicaid policy changes and other things take effect, there tends to be a focus on revenue generating functions. And doctors who can bill, who perform services that are billable, generate revenue. And in some sense, everyone else is a cost center. And that includes the hospital executives themselves, who, if they have a clinic, it might be once a month, but it also includes the support functions that, though they may reduce cost, it may be very hard for a hospital to account for that and say, well, this child life specialist saved us a readmission, which would have driven up cost this much, and therefore, thank you. Like, that was worth the investment and then some. And so there can be difficulty, kind of, with an organization kind of knowing and remembering that there's value here in the individuals and in the job functions that aren't necessarily explicitly generating revenue. And so I think that's, especially with the cycles of reimbursement being where they are today, it is something I'm concerned about, that hospitals make sure that they're keeping the full team on board, even when there may be pressures on them to find ways to cut costs.
Yeah, it's critically important, but you raise such a good point about revenue generating versus cost centers and how that does play a role ultimately in the care of families. And you've been in this field for a long time, as you said, and reporting on a lot of different things. And we've talked, I think, a lot about some of the things that are going really well and some of the things that our hospitals are doing really well. What do you think is maybe broken and some hospitals need to fix?
Can I answer that by sharing a personal story?
I
Um,
would be honored to hear your
it,
personal story. Absolutely.
so my cousin, who is now in his 50s, was born with a congenital heart defect. It's a fairly rare and pretty serious one. Even today, it's considered a high risk, congenital malformation. 50 years ago, when he was born, it was very challenging thing to treat, and there was no U.S. News Best Children's Hospitals rankings for him to turn to, or for his parents, I should say, to turn to. And they found, through their doctor, through their cardiologist, a heart surgeon who was ready to take the case and was confident in his skills to do it. And what they couldn't have possibly known at the time was that hospital didn't really have the structure, the team, the experience to achieve a great outcome for their child. The surgeon was very skilled, and by all accounts, the surgery went really well. But there was a complication in the ICU afterward that left him with a permanent brain injury. And it's my belief that had they had the kind of resource that US News now provides to families, that they might have identified that that hospital didn't have adequate experience treating that condition, didn't have the whole team and the depth in their bench to support that child after the surgery and make sure that they had the right outcome. And they might have, in fact, chosen a different hospital if they had the resources, had a resource to point them in the right direction. And I think about that a lot when we are gathering the data that we gather, when we're analyzing it, when we're putting together the rankings and making sure that families know about the data that's available at usnews.com, because I really wish that my aunt and uncle had access to a resource like that 50 years ago when they were trying so hard to get the right care for their child, and the information just wasn't available to them.
Thank you for sharing that. And please thank your family for allowing you to share that, because it does mean so much to have validated resources in the age of having access to so much information that is disguised as opinions and facts. It's amazing. And I have so much gratitude for people like you who make it their life's work to give us clear data as one of the parts of the decision process that we make when it comes to kids and families. Before we hopped on this call, you shared a personal anecdote about having your child have access to a child life specialist. And I want to thank you for sharing that with me, because there's not enough of us to go around. Unfortunately, only 6,000 here in the United States, and not all of us are working full time. Over 29 million kids go to the ER alone. That doesn't even account for NICU stays and hospitalizations. And so as part of our mission here is to provide support to parents and a safe space to share their story. Our other mission is about spreading about the importance and the efficacy of child life services here. So you speaking with me today, sharing your personal stories and giving your amazing insight means the world. And thank you for letting us be a part of the conversation to have access to this. And as I was reviewing the information before our interview today, I noticed there were some specialties that called out child life services specifically, and some of the scorecards, if you will, child life service was included in the overall support group. But then there were some disciplines like asthma care or cancer or nephrology that called out child life. And so I hope that we can continue to be a part of these powerful conversations, as we know it makes such a difference. When I'm talking with families on the podcast, they'll look back and they remember we were talking about parents understanding and becoming medical experts overnight. It is truly miraculous that they can essentially go to med school in just a couple of weeks and become experts on their child's diagnosis. But a lot of the things they remember are how they felt, and that they felt taken care of, and that maybe the child's outcome wasn't what everyone wanted and there was a death or bereavement, but the way the care team made them feel has a real impact on how they move throughout their life. Your child who had access to a child life specialist and now remembers the toy that they gave, that builds on their healthcare experiences from here on out, and they can
You're right.
develop that
Yeah,
trust. So
that's true.
I thank you
Yeah,
for
he
your
he kept that
insight.
toy for many years. He may still have it, in fact.
Yeah,
and
yeah. I
it
mean,
and
my
it yeah.
daughter had a burn on her face, and we had to go to the ER, and she still sleeps with that blanket every night from 3 years
Mm-hmm,
ago.
mm-hmm,
So those are
mm-hmm.
the things that aren't revenue producing, so to speak, that we can count
Yeah,
or measure that
yeah.
well, but are really important and impactful when we think about the human experience.
The human touch is never more important than in pediatric care. It's both the child and it's the parent who's watching their child go through something life altering. And I remember the child life specialist and how sweet and tender she was. And I also remember how calming and soothing and reassuring the anesthesiologist was. And as a parent, I was deeply anxious about having my child put under. He was too young to even know or to anticipate that. But for me, just seeing the easy manner that physician struck with my child made me feel better about the whole experience, both during and after.
It's wonderful. Well, I want to ask you just one final question before we close. And I'm thinking about the parents who are choosing healthcare for their child and deciding where to go. From your perspective, what kind of trends, or maybe not trends is the right word, but what should families come to expect when it comes to a level of service? And I'm not saying they have to feel like they're at the Ritz, but what should they expect when it comes to family support resources, and what can they ask for?
That's a great question. You may be better positioned with your expertise to set their expectations on what they can and should ask for. You know, my sense is that they should ask for whatever they think they need, whatever they think their child needs. The worst that they can hear is no, or that's not available, or it's not available right now, but we'll see if we can, try to arrange it. I mentioned before that, you know, no one is more motivated and becomes an expert faster than a parent with a sick child. But I also think that those same parents are the best healthcare advocates in the world. Um, Adults can be shy and not feel comfortable asking for something for themselves, but when you see your child in a gown on a bed looking nervous, you're going to go to bat for them. And I would just say I want to give parents permission to do that. They should not hold back one bit if they feel like they need to advocate for their child in anything, for their emotional needs during the psychological trauma of going through hospitalization, or for their physical well-being if they have any concerns about some change in the vitals, or just the kid saying they don't feel right. Like, those are cues that parents are inclined to listen to. I don't need to
Yeah.
coach them on that, but I want them to lean into that, because it could be life-saving for their child. And good care providers want to hear that. They want the family engaged, and they're appreciative when the family catches something, sees something that might need attention before the nurse or the other member of the care team does. Like, they are part of the care team, and they know their child better than anybody, and they're the strongest possible advocate for their child. So I would tell them, don't hold back.
I love that. And there has to be a little bit of a generational switch there for us, because I know growing up, you don't question the medical doctor. They're the ones who know everything. But when you come at it with the lens of not questioning, but collaborating and giving your insight and your expertise, it's easier to transition from bystander to advocate. And I always think it's so interesting about how, as parents, we may be able to advocate very easily to the coach, and our child hasn't got to play infield in 3 innings, and why are they still in the outfield? But when it comes to the healthcare system, we can sometimes initially want to take a back seat because you feel like you don't know as much. But that is the exact reason you should ask and should advocate. And I just want to appreciate, for someone with your experience and looking at all these different data points, validating that for families. So thank you.
Mm-hmm. Mm-hmm. Yeah,
Yeah.
there's no harm in asking a question to what's going on, or why are you doing this. I mean,
Yeah.
no one is going to expect you to be an expert in what's happening in the ICU, or but you have every right to ask and to understand.
Wonderful. Well, Ben, the rankings are available now. Where should families go to look for this information, and how, if they want to learn more, can they do that?
Yeah, usnews.com. As I said, it's freely available to anyone. They can find our hospital rankings there. usnews.com/hospitals will guide them in the right direction, and they can search by where they live, by what specialty they need, by both those things and more, to find hospitals that we think, based on our analysis of thousands of data points, are among the strongest in the area that they may need help for their child.
Wonderful. Well, thank you for being with us today.
Yeah, thank you. Appreciate it.
For those of you who are joining us today, I am not a doctor. I'm not a therapist. I am a child life specialist. And the suggestions and tips and resources that I talk about with parents on this podcast may be great for you and they may not be right for you. So, the most important person you can talk to about getting support is your care team, your doctor who knows your story and your child's story. So, regardless of maybe what I mention or what other families mention here, we're not licensed therapists, we're not doctors. We're having a conversation about what the parenting journey has been like. So, please keep that in mind as you listen today.